Now, the title of this evening's presentation, Alzheimer's Without Dementia, The New Journey of Care. It may only be 8 words long, but I believe it speaks volumes. Because, as we're going to hear from our speakers this evening, what it contains is the suggestion that research into dementia could be turned on its head. Revolutionized even, with a whole new family of drugs being developed to reduce and eventually possibly even eliminate the effects of dementia from people's lives. Now, I do know that everyone in this room is connected with dementia in some way or another, so I certainly don't need to describe in detail to any of you the scale of the social, economic, and medical dilemmas that are caused and presented by dementia. I think we all know that every 4 seconds a diagnosis of dementia is made somewhere in the world, and that there are 7.7 million new cases of dementia registered every year. And that according to William Teese, who's the Chief Medical Officer of the Alzheimer's Association in America, Alzheimer's has the potential to bankrupt healthcare systems and ruin the economy. And boy, does all that sound negative and depressing. But I don't believe it has to be that way. Here in Britain, our government announced last week, for instance, that dementia patients are going to be diagnosed within 6 weeks rather than 6 months. And that announcement was certainly a step forward, not least in helping to remove, I believe, the stigma that still clouds any form of mental illness. It means that over the last 7 years, certainly that I've been involved with Alzheimer's and dementia, that it is coming out of the shadows. And I think that that announcement is certainly a welcome improvement, even though it has been too long in coming. But Health Secretary Jeremy Hunt's assertion that Britain is going to become a global leader in combating the illness and in searching for a cure does ignore one vital ingredient. And that is a comprehensive care system in health and social services and education of the broader community. It is all very well having people diagnosed earlier, but without a network of care to support Britain's 800,000 Alzheimer's victims and their often overwhelmed families and carers, it's going to mean very little, because the demands on carers and families are only going to increase. Here in Britain, it's estimated that 1 person in 3 over the age of 60 is going to develop a dementia of some form, whether they know it or not. And yet it seems to me that only now has the full scale of the problem finally been recognised. And finding the solution to those problems, well, it is a very complex challenge. I always feel it's a bit like peeling away the layers of an onion, because dementia brings with it not just medical dimensions, but also a social, financial, and political agenda. It needs a coordinated approach involving GPs, hospitals, research teams, social services, and the wider general public. Now, I discovered some of this when my late mother, Edna, developed vascular dementia in 2006. I, at the time, like so many people, was absolutely ignorant of the illness. So that was really in 2006 when I began my journey on a very long, steep learning curve to the point where I am today as an ambassador for the Alzheimer's Society and co-chair of the Dementia Friendly Communities Committee that was established by our Prime Minister to encourage dementia-friendly communities around the country, and also to introduce dementia awareness into schools so that we might begin to create an entire dementia-friendly generation. But going back to point 0, at the very beginning of that journey, I have to say I was a mess. Not understanding that when my mother asked the same question 10 times in half an hour, that I had to suppress my frustration and deal with it as if it was the very first time I'd heard it. Not to lose my temper with her when she had an outburst of hurtful, unprovoked vitriol. To accept her agoraphobia and begin to inhabit that parallel universe where she lived most of the time towards the end of her condition, when she was having tea with long dead members of the family, or when people that she had known in her youth were sitting on the end of her bed. Also, dealing with the dark arts of social services became a rather personal challenge to me, as did tackling head-on the stigma that society has always attached to this illness. I remember when I became an ambassador for the Alzheimer's Society in 2009, being asked by a journalist, "Aren't you embarrassed to be talking about this?" And I would say, "Why?" And she said, "Well, it's a mental illness, isn't it?" And it was that attitude that really kept dementia out of the headlines, confined it to the shadows, where all too often you could actually also find families and even dementia patients themselves, all of them in denial, afraid to say the dementia word in the way that people used to shy away from cancer, just whispering about it as the big C. Afraid because they knew that the stigma would mean being abandoned by friends. It happens. Facing a lonely, isolated life as both a dementia patient and also a dementia carer. But I'll say again, it doesn't actually have to be that way. So let's start peeling away those layers of the onion. First, diagnosis. All too often we've found some GPs, not all, because there are thousands of GPs in this country who are absolutely wonderful when it comes to diagnosing dementia and providing support services. But we've also discovered too many who have been unwilling to offer a diagnosis or even deal with their patients' concerns over early symptoms. And their attitude has been, what is the point of diagnosing the illness if there is little or no support within the community for the person with the illness and their carer? Now, you wouldn't dream of applying that logic to someone with cancer, heart disease, or diabetes. So why apply it to dementia, an illness which costs the UK economy 23 billion a year, more than cancer and heart disease combined? And incidentally, if the figure that I've seen on the National Health website of the present cost of the National Health Service of being £109 billion a year, that's almost a quarter of it. Early diagnosis can mean access to medical support, being able to understand some of the changes that are affecting your personality and capabilities. It means you can put your affairs in order and lead normal lives for many, many years as valued and involved members of the local community. So let's next start to demolish this idea that there is no safety net for families once there has been a diagnosis. Local authorities really do need to beef up their social care budget for the provision of things like memory clinics, daycare centres, help at home, and regular support from community nurses. And indeed, a decent rate of pay for carers, and a workload that enables them to spend quality time with clients, not rushed visits where the choice is either paperwork or helping with personal care. Respite and support for family carers is also essential. All the things that enable the person with dementia to live well with the condition, at home and within their community, which is where most of them much prefer to be. So I would urge the government to begin by allocating more funds to the social care provisions within local government to ensure that those who have dementia and their families are not denied help when they need it most. Let's move now to society's role. And again, so much can be done to support people with dementia and their families within the community. Now, as co-chair of the Dementia Friendly Communities Committee, which was set up 2 years ago, as I say, as part of Prime Minister David Cameron's Dementia Initiative, my role includes bringing together companies and organisations and helping them to train their staff to recognise signs of dementia in customers, even within their own workforce, so that they can be supportive of those who are affected by dementia and not put them in positions where they're embarrassed, isolated, sidelined, or put at a disadvantage. We're also working with local communities in cities, towns, and rural communities throughout the country to create those dementia-friendly communities. And our work in schools, now in 140 schools in the country, by the end of this year, hopefully in 500 schools, is helping us to provide and create that dementia-friendly generation. Whilst our Dementia Friends scheme enables any member of the public to learn about the condition and become a dementia champion within their own community, to provide help and support to families who are affected by dementia when and if they are needed. Clearly, there is a great deal that communities and the public can do to take dementia out of the shadows by helping and supporting those who are affected by the condition and enabling them to live well with dementia. And all of these initiatives cost either nothing or very little. And finally, research. Well, there is no way of getting away from it. Dementia has been the poor relation. Cancer research receives more than 8 times the funding that is put into dementia, and yet the reach of the illness is far greater. So we need more money, and we need it to go into the right kind of research, focused on those areas that will bring positive and early results. We simply cannot afford to wait until 2050 for a result, because frankly, by then, so many people will be affected, we actually run the risk of forgetting altogether what it is we're trying to achieve. Which brings us to this evening, and what we're trying to achieve through this meeting. We want to bring an optimistic vision of the future, one where a person can have Alzheimer's disease without having dementia, because it's being treated as a long-term, manageable illness, something that I think every one of this evening's speakers is going to endorse.